Hello friends, I'm Dr. Schulze, and this week's letter is from Tammy M. from Virginia Beach, Virginia, and she says, Dear Dr. Schulze, my husband is 28 years old and I'm 24 years old, and we've gone through 9 cycles of IVF, which means in vitro fertilization. The last one resulted in a healthy baby boy who is now 8 months old. Now, I've said many times, in vitro fertilization has an 87% failure rate. A lot of people don't know that. 87% failure rate, because we're trying to do something that your body doesn't want to do. Your body doesn't want to have a baby for one reason or another, and you have medical doctors forcing you to have children even though your body doesn't want to do it. That's why they went through 9 cycles of in vitro fertilization to get one pregnancy. Okay, we would like to start trying again. However, after reading your blog, we are not going to do in vitro fertilization again. Rather, we're going to try to get our bodies back in check and get pregnant naturally. Thank you, Tammy. You listened, you read, and you understand. When you can't get pregnant, it means that you and your husband or both are not healthy enough to have a baby. This is a natural protective process of the human body. Fertility is only rewarded to those that are healthy enough to have a child. If you're not healthy enough to have a child, your body knows that, and therefore you will not have the ability to get pregnant. And if a doctor, a stupid, ignorant medical doctor, gives you IVF to try to force your body to become pregnant when you're not healthy or your husband isn't healthy enough, what do you think is going to happen? You're going to have babies prematurely. Those babies will be sick. You're lucky if your boy is not. Or you're going to have miscarriages. It's a mess. When your body says you can't have children and doctors try to force the issue, it's dangerous, it's stupid. Okay, do you have any advice on what you think we should try in order to get our bodies in line to get pregnant? That would be wonderful. I have lots of advice, Tammy. We've had one set of twins born at 20 weeks. See, that's exactly what I'm talking about. I'm sorry about that. One ectopic tubal pregnancy resulting in the removal of one fallopian tube. Sorry about that. And one healthy pregnancy, which I was on IV infusions every other week until I was 24 weeks pregnant. Okay. Now, Tammy says about us, my husband has a very low sperm count with quite a few being abnormal slow movers. That's often a problem that women forget about, is the husband. In order to get pregnant, you have to have a healthy husband, a healthy man, and a healthy woman. And a husband's got very few swimmers, bad swimmers, slow swimmers, so we need to get him healthier. Myself, I'm going through all the tests for IVF. I have now been told that I have endometriosis and other problems, only one fallopian tube, and my husband and I are not a very good match either. We've been told that. Well, let me tell you something. Your husband and you are a good match because you're together, so don't worry about all the medical tests. Okay, here's what we started. We both take 2 dropperfuls of male for my husband and 2 dropperfuls of female for me 3 times a day. You've been listening. 2 dropperfuls 3 times a day. Good job. Check. We both take the male for him and female for me shot 2 times a week. Male and female shot. Check. Good job, Tammy. You're really listening. You could be teaching this. We take 35 capsules of Superfood Plus in the morning, 10 more at lunch, and 10 more at dinner. Tammy, yeah, baby, this is good. And 2 dropperfuls of echinacea 3 times a day. This is awesome. Also, we did your 30-day detox, and I did an additional 5-day bowel detox 1 month later after that. We've also cleaned up our eating program, very important. I would have mentioned that. And we're trying to eat mostly organic raw fruits and vegetables. Amazing, amazing job. You're doing great. You must have really read, understood, and followed my advice, because that's exactly my advice on how to get pregnant. Again, any advice would be appreciated. Okay, yes, you're doing awesome. Anything I don't see in here, well, you've done the bowel detox, you've done all the detoxes because you did the 30-day detox, you're taking the superfood, the male and female tonics, the male and female shots, echinacea to boost your immune system. You're really doing it all. You don't mention much about your movement, and sperm counts are increased in men and women by movement. Pregnancies become healthy by movement. So I want to make sure both of you are involved in a good movement program 5 or 6 days a week. Get out there, get sweating, get aerobic, get toned, get fit. And also make sure that you're both really wanting to have kids and that emotionally and spiritually you're behind this. And my only advice to you would be patience. Now it's time to be patient. Most women in my clinic, without any problems, with husbands with good swimmers, and them not having one fallopian tube and any problems, followed the program exactly that you're on, and in 3 months they were pregnant. For you, could be 6 months, it could be a year. It's just going to take a little longer. Your husband might want to add in a little super ginseng. Your husband needs, refine his workout program. You too. But now it's time to just be patient. You're going to get healthier and healthier and healthier. There's a lot of benefits to this. First of all, your children, and I'm going to use that plural now, your children are going to have healthy parents and they're going to learn healthy habits because they're going to be eating well and having good lives, having parents like you. But just be patient now, and the next thing you know, you're going to be pregnant. Thank you for the letter, Tammy. Good job understanding about in vitro fertilization, not only the 87% failure rate, but how you're going to end up having children or problems with pregnancies and stillbirths and miscarriages and all that. But also understanding that you need to get healthy. You have to earn the right to have children. Some of you are lucky and you don't. But some people have to earn the right, and the only way to earn that right is to get really, really healthy. Thank you, Tammy from Virginia Beach. Every one of my patients in my clinic was able to have babies except for one woman who had a horribly deformed uterus. That's every patient I had was able to get pregnant, go full term, and have babies. All they had to do was get healthy, get their husbands healthy, and get healthy. You can do it, Tammy. Good luck.